So when it came to my first standardized patient of my senior year, I felt that I was pretty confident going in. I had no idea what the case would be, which is with any standardized patient, but just being my senior year, I felt confident in the skills that I knew, and I knew that I could perform a decent evaluation of the patient. Things that went well during this encounter was, I feel, mostly on patient communication. When I walked in, the patient was acting sick, so what did I do? I grabbed the trash can and put it next to them, which instinct tells me to do that anyway, but I just felt that was a good idea. Other things that went well, just the communication as a whole with the patient. I felt like I'm getting better and better each time, which is the purpose for these standardized patients, giving me that extra encounter that I need. Things that didn't go well, I feel like my structure is still a little off when it comes to doing a gen med eval, which that's expected as I mainly do musculoskeletal evaluations at my clinical site. I think you can see me in the video going back to the med pack looking for the pulse ox because I was dead set on getting a pulse on the patient, which I couldn't find the pulse ox, but that's okay. When it comes to how this encounter will affect my patient care in the future, I'm going to have a ton of gen med cases that involve the patient having flu-like symptoms. I know that it's bound to happen a lot, especially when it gets colder out within the winter time. But all in all, it was a great standardized patient, and I was fairly happy with the outcome. I just know the little details that I need to work on now to help me out with future encounters and future patients.